take the floor. Thank you. You are with
The meeting of today was just an inception meeting for our development partners in the program Nurturing for Earlier Development, Child Development Programs, which we call the Smart Start. We realized that there are key areas that affect child development, which lies within the county government. When you talk about the health of a child, all the health services, most of them that affect the child development lies within the county provision. You talk about food, nutrition, agriculture is within the county, which is supposed to improve the food production. Talking about water and sanitation, all these areas talk about education, the early childhood development or education lies within the county. So we are seeing the best way we can partner with our development agencies in improving the welfare of the child within Migori County. The figures in Migori County are not looking good. However, with the commitment of the county government in the budget allocation, in doing partnering with the other development partners, these figures will going to improve.
Today I am here to receive the torch of nurturing care for early childhood development. We've been taken through the situation in Migori. The situation is not good, the figures are not good, we are losing children, we have stunted growth, we have malnutrition, and we also learned that malnutrition does not choose. You may think you have so much money or you have a lot of resources, but if you don't pay special attention to nutrition, then you and your children will be malnourished. So today I'm glad that all the departments within Migori County are represented in this meeting. We expect coordination from the various departments so that we can help the child. We expect agriculture to provide the food, finance to provide the money, health to provide the services, education to provide the conducive environment for our children so that we can achieve a high potential, our children can thrive, and when children thrive, the families remain happy.
Sierra County has been implementing the nurturing care for early childhood development since 2018. We think that it is the most important program, and we're very proud that it is anchored in the office of the governor, and I act as patron of that very noble initiative. It's the most important program, I think, in the entire county government. It's an integrated program. It is an all-of-government program that is supported with financial resources, and we're very hopeful that the counties that are coming after us to implement the Smart Start initiative will do as we have done and perhaps even do better. We think that the risk factors that are being identified are worthy of our attention, not just in the Arab region, but nationally. The issue of neglect points to the fact that we have unresponsive communities, and one of the key factors in implementing the nurturing care framework is to deal with responsive caregiving.
Monica Obutu, I'm the CEO of KMET. KMET is the leading implementing partner in the Smart Start initiative. Our role as partners is more of catalytic. We are actually just, first of all, creating awareness on a smart way of investment. You can't wait until children go to the university and then you want to have the best universities and support them while we did not build their brains. So it's a matter of building the brains. As we invest or budget, we allocate more budget maybe on constructions, on the roads, but we need to build the brains of our future children. So we are starting this very unique initiative that starts from conception, actually starts from pre-conception. We are first of all engaging the adolescents and telling them, to delay. Don't be pregnant when you are 10 years, 14 years, because you are a baby. We are seeing so many children in Migori taking care of children. So that's where we are starting. You know, baby mothers, that's also a risk in our counties in the Lake region. So for us as partners, we are now implementing this. It started from Siaya. It was modeled there, and we have seen it work, especially when all the line ministries come together. It's not a health issue, it's not education issue. Sometimes when we talk about early nurturing care for early childhood development, people think of ECD structures, and we get ECD centers constructed. We are start from zero and journey with this baby in the uterus. How do we see the deliveries in Migori? We are still getting quite a number of mothers delivering at home, as you have rightly put it. So that's where we are starting from. When we want to invest smartly, ensure that adolescent pregnancies are reduced, ensure that women are delivering in the right place and a skilled birth attendant, ensure that even at birth, some of the complications are mitigated.
The early part of the child matters so much in the development of your maturity. We have to start with the early 1,000 days for the child from inception. It plays a major role in your future growth. So we need to address that before we come to address the issue when it's too old. We are partnering with the other partners, NGOs, to make sure this program goes ahead, because it's really played a major role in the development of the brain and the early part of the child.